Hello colleagues, my name is Kenny Gibson and I'm the National Head of Safeguarding for the NHS. I'm also a proud nurse. I want to talk to you today about Fab Pledge 22 to 23, where we must all reconnect, we must all recharge, we must all rebuild and bring a sense of renewal. And I want to focus specifically on trauma-informed approaches to that. We hear a lot about trauma-informed approaches in clinical press and clinical practice and between clinicians. But what does it actually mean? One of the things I've come to understand about trauma-informed approaches is that we must realise the widespread impact of trauma and understand the paths for recovery. And that is not only simply on our colleagues, on our patients, but it's also on ourselves. So realising the impacts is critical. How do we recognise that? Well, first of all, we must understand the signs, the symptoms of trauma in our patients, but also in families, in our communities, and in ourselves. That is critical as well. So once we realise and once we recognise, the next thing we need to do is we need to respond to that. We must be fully knowledgeable about trauma in policies, procedures, protocols, so that once we recognise and realise trauma has happened to someone, or indeed ourselves, we can respond appropriately using strength-based approaches. One of those strength-based approaches that we must respond with is we must avoid re-traumatising. So one of the things that I've learned to do is really intensely listen to the lived experience, the voice, the words, the narrative that my colleagues use when they're describing their trauma, my patients use when they're describing their trauma, or indeed that I reflect on when I describe my own trauma. No one should think that working in the NHS or being a clinician limits or inhibits themselves from trauma. And so therefore there are two important things that we must do and have in our armoury or toolkits. And this is my Fab Pledge for 2023. One is we must be prepared to challenge our own unconscious bias that trauma cannot happen to self. That trauma cannot happen to patients or colleagues as part of our working day. It does happen, it will happen, and we must be ready to challenge our unconscious bias to listen to all sorts of trauma. Whether that is neglect, whether it is abuse, whether it is exploitation, or whether it is violence. And that is a difficult ask. Our unconscious bias is born out of our comfort zones. It is born out of what we've been developed in. So let's support each other to challenge our unconscious bias around trauma-informed processes. The second thing I want you to consider pledging towards for trauma-informed practice, as I am doing, is bringing hope. The role of nurses, clinicians, carers, or anyone with human rights in their toolkit of skills must be a pledge to bring hope where there is trauma, so that victims of trauma, or indeed my own trauma, I can feel the hope of recovery. So as we learn more about trauma-informed approaches, let's remember, let's realise the impact, let's recognise the signs and symptoms, let's respond in an integrated way through policies and procedures. Let's resist re-traumatising. But more importantly, let's support each other to challenge unconscious bias. Let's challenge each other and support each other with hope that recovery is possible from trauma. Thank you for listening.